Each Wednesday, we'll be inviting someone to make an argument on an issue of public interest, which will then be challenged in studio. We're hoping for some lively debates. Our first proposition comes from Joe Bissett from the parents group Us for Them.
Children should not have to use face masks in schools. There is little, if any, scientific evidence to show that face coverings are effective in reducing incidence of COVID-19 in schools. Yet despite this, our kids are being told they need to mask up every time they enter the school building. It's damaging to their mental health, and their entire interactive learning experience suffers as a result. In the summer, we formed a campaign for a return to normality in schools. Anything other than that could damage our young people irreparably. And our 10,000 members in Scotland agree. Let's keep the face masks out the school building and provide children with the nurturing environment they deserve.
Joe is now here in the studio along with Susan Quinn from the EIS Teachers Union. Thank you both for joining us. Joe, schools have been back for a few weeks. The kids don't need to wear masks in the classrooms just when they're moving about in communal spaces. I mean, there doesn't seem to be widespread unrest about them wearing masks. So what's the big deal?
So face masks for school children are a really invasive and ineffective mitigation measure against COVID-19. So we are absolutely in favour of effective and proportionate measures that will protect children and staff in schools. But face masks are neither effective nor proportionate. So as we already know, the evidence for face masks is very, very weak. Dr. Gregor Smith said that just literally 2 weeks ago. The evidence is very, very weak. In fact, it may be the case that the use of face masks increases the risk of transmission in schools, as was highlighted by Public Health England, Professor Russell Viner of the Paediatric College. There's plenty of evidence that shows that face masks aren't very effective and may be ineffective.
Susan, you're a former head teacher. You've heard Joe's position. You don't agree. Why?
Well, it's not that we don't agree about face masks per se. What we're looking at is a situation where we have to be making sure that all mitigations are available for staff and pupils within our schools. What we've seen, you said yourself, face masks, face coverings are not expected to be worn anywhere other than in communal busy areas. And that's come about as a result of the effects of the return to school, where we've seen the 2 metres distancing, the difficulties that in putting forward the health and safety measures in our schools, and it came from discussions between staff and pupils. In many of the cases, it came from the pupils themselves that they had concerns that they were seeing the measures outside of school in place and then not carried forward into school. So what we have in place at the moment is a situation where over 12s are wearing them in a small period of time during the school day, in order where they can't physically distance. And our members have real concerns about the ability to physically distance within the buildings.
And I'm afraid there's not full information there. So what we have already started seeing is that some schools are enforcing face masks in certain classrooms. And we knew that there was always going to be a slippery slope here, because if the logic for wearing face masks in corridors and communal areas is good, then you're on the slippery slope. And before we know it, there will be children wearing them all over the school. So we're seeing children being forced to wear them in science classes, in home economics classes, in design technology classes. And this is just the beginning. And I do ask, where are the risk assessments for children wearing face coverings, which are not CE marked, which are not fire retardant, when they're working with a Bunsen burner? I don't think this has been properly thought through. And also, if I could also say, 5-year-olds are forced to wear face masks on school buses. And this is just such an inhumane enforcement on our youngest people.
But there is scientific evidence out there to show that it actually does help stop spreading the transmission of the disease. So why not just use it if it's another weapon in the battle against COVID? Why not just do it?
So the evidence at best is very, very weak in favour of face masks. The actual evidence says probably children are going to transmit COVID-19 more in schools because they don't use face masks properly. So the evidence isn't there. What we are calling for is proportionate and effective measures. So that means basically adult to adult social distancing.
If the evidence isn't strong, I mean, what's the point of it, Susan?
So the point here is that we would say that what we want to see are proportionate and proper measures in place to protect everybody within a school building. What we want to do is do everything we can to keep schools open at this time. And to do that, we need to make sure that the virus continues to be suppressed in our communities, and we need to do our parts within our schools for that. What we have in place is a situation where there is supposed to be 2 metre distancing between adults to adults in schools and adults to young people because in our secondary schools our young people are being classed as adults. And what we can't see at this point in time is that happening, because our buildings are overcrowded, because we don't have a situation where our class sizes are small enough to allow us to do that effectively. And that's why in some of these other subjects, the practical subjects, it is impossible for our teachers to physically distance.
Picking up on another point, you say it's damaging to children's mental health. I mean, what evidence have you got for that? We're only a few weeks into the school term, so it's not a bit early to say that.
So I would say you really need to look at Professor Ellen Townsend, who is the head of the self-harm unit at the University of Nottingham, and her team have written extensively on the impact of lockdown and the various measures that we have enforced upon our children. And there is already extensive research that shows that these measures are having huge impacts. So look, children, 1 in 10 children have language and communication developmental issues. Those children are going to really suffer. What about the children with hearing impairments? Those children are now not going to be able to speak to their friends.
And Susan, just in Denmark, that was one of the first schools in Europe to go back. They are not making children wear face masks, and there hasn't been a spike in cases there.
But can we be clear? We're not making children wear face masks in our classrooms in this country either. The mitigation,
they're not wearing masks at all in school in Denmark, and there is no spike.
And we weren't either here in Scotland until we returned. What we have seen in other countries is an ability to have smaller class sizes, which allows for the physical distancing, which allows for all of the other risk assessment work to be put in place. And that's why they are not seeing the spike that we potentially will see. What the EIS would like to see is a position where we had class sizes that were small enough to allow our young people and teachers to physically distance effectively from each other, and that way everybody would remain safe within the system.
And we will have to leave it there, Jo and Susan. A very lively first listen up. Thank you both very much indeed for joining us this evening.